There are 168 hours in a week. The healthcare system may account for a few of them, but patients and families live through all 168. That is the part we sometimes forget. The wife in this story was not a nurse. She was not a case manager. She was not a billing specialist. She was simply a wife who found herself carrying a tremendous amount of responsibility because someone she loved needed her. And that should resonate with every physician, because we see versions of this every day. The daughter who brings her father to every appointment. The husband who keeps track of every medication. The caregiver who remembers what happened at the last hospital visit better than the medical record does. The nurse who stays late to make sure a patient gets what they need. The medical assistant who spends an hour tracking down information. The physician who finishes the last patient and then starts the second shift of documentation and administrative work. Healthcare doesn't happen only during the appointment. It happens in the hours between appointments, and those hours matter. So here is the question I want to leave with physicians and healthcare leaders. What work are we asking people to carry that the system should be carrying for them? That question applies to caregivers. It applies to nurses. It applies to physicians. It applies to medical practices, and it applies to healthcare technology. Because the future of healthcare shouldn't simply be about making people better at carrying more. It should be about building systems that give people less unnecessary weight to carry. If this resonates with you, tell me why in the comments. What is the administrative task in your practice that everyone has learned to tolerate, even though everyone knows it shouldn't work this way? Share your experience. And if you know a physician, practice owner, nurse, caregiver, or healthcare leader who needs to hear this, share or repost this article with them. Maybe your comment identifies a problem someone else has been struggling with. Maybe your repost starts a conversation. Maybe that conversation leads to a better system, because healthcare does not need more people becoming experts at working around broken processes. It needs more people willing to question why those processes exist in the first place. The goal isn't simply to work harder. The goal is to make healthcare work better. If this perspective resonates, share it. Someone in your network may need to see it today.